The University of Tennessee Medical Center is our region's only academic medical center. Our mission is to serve through healing, education, and discovery. Our goal is to share the knowledge of our physicians and staff in these health education videos as you make healthcare decisions for yourself and your family.
Women prevent cervical cancer in many ways. First and foremost, we have now an HPV vaccine that is very important to decreasing the risk of cervical cancer. We normally suggest that that is given at ages 11 or 12, but if somebody hasn't gotten it at that age, it can be any age after that. In addition, smoking is a very big risk factor for cervical cancer, and so we recommend that you stop smoking if you do smoke, or don't start if you don't already. And then additionally, there's routine screening that we advise to prevent cervical cancer. Routine screening consists of pap smears, in addition following up with abnormal pap smears. Now, the pap smear guidelines are changing over time, and so it's difficult for a woman to know when she's due for a pap smear, but you'll just have to discuss with your GYN doctor or regular physician to know when you're due for your next pap smear. As long as a woman gets a pap smear on a regular interval, that drastically decreases her risk of cervical cancer. If a woman's been diagnosed with an abnormal pap smear, there's usually additional follow-up that's necessary. Oftentimes, this requires a procedure called colposcopy, which is just looking closer with a magnifying glass at the cervix to try and tell abnormal cells from normal cells. A biopsy is often necessary, so that can be sent to pathology to be looked at under a microscope. Sometimes a small procedure called a loop biopsy or a cold knife conization is necessary, often done in the operating room, so that we can really get a good look at what's going on at the cervix and try and prevent cervical cancer. For women that have been diagnosed with cervical cancer, there are several different options. If it's an advanced lesion, then radiation therapy or chemotherapy might be necessary. For smaller abnormalities, radical surgery is usually sufficient, and that includes what's called a radical hysterectomy and a cancer staging procedure. That's usually done by a GYN oncologist, and this is a bigger procedure than just a routine hysterectomy.
We hope you'll join us for another medical moment. Visit utmedicalcenter.org or call the Healthcare Coordination Office at 865-305-6970 to learn about services available at the University of Tennessee Medical Center.